So we have a headband on for safety and comfort, and then for the neck we put a thyroid cartilage cover on as well. All right, Ryan, go ahead and look up to the ceiling a little bit for me. Thank you. All right, go ahead and look forward. Okay, so then the device, we just hit next and it instructs us to do those same instructions. Headband, plugging it in, and now we can go ahead and apply the head garment. So we apply the nip one first. And then the head strap we make extra snug. And then we go ahead and check vitals, and we go ahead and start the device. And it starts a cool down period. So during the cool down period, we let this one be a little bit looser so the coolant can circulate through, and when it hits 6 degrees Celsius, we tighten it just so we know the coolant's through and it's not like too snug.
So Ryan, you've used this before. What is it? Is it just, does it feel like ice packs?
I mean, obviously it does. It feels kind of like an ice pack, but also I feel like it's a lot more relaxing, and obviously you can like sort of feel the coolant flowing through, and I feel like it's a lot more effective than an ice pack would be for treating a head injury. And overall, I'd say that it's really relaxing and nice.
Do you usually sit, or are you laying on a table when you're doing it?
I've been sitting.
Okay.
It feels pretty comfortable.
Okay. Does it get really cold?
Yeah, but it's not like you feel freezing. It's sort of just like a comfortable cool, like as if you were like sort of like in an ice bath.
And Peyton, is it 30 minutes the whole time cooling, or is it off and on?
So it'll go down, it'll cool down from 20 degrees Celsius all the way to 6, and then it starts.
What is that in
timer.
Fahrenheit, do you know?
What?
Do you know what it is in Fahrenheit?
No, usually the
Okay,
device
I
is a
saw
little
something.
cheat code and gives it.
Okay.
So when it gets to 6 degrees, it starts the 30-minute timer, and then that's the actual cooling therapy for 30 minutes.
And that's for the 30, okay.
Yeah.
Gotcha. And Dr. Congini, what's the idea behind the, cooling the head during a concussion?
Yeah, Ryan, I really want to thank you for helping us try to get to the bottom of answering some questions about this real difficult problem that is concussion. And so the thought behind it is that, we ice a lot of other things. Ice has a very strong analgesic effect. It has an anti-inflammatory effect. Not sure if all those things are necessarily going to be in play here or not, but I think for so many injuries that we see, that from being an athlete, we ice the knee, we ice the ankle, we ice a thigh injury, and I think it makes some sense to ice the brain, number one. And number two, for a lot of years that I've been working with athletes, 30 years or so, in those unfortunate cases where kids have been concussed, they always ask for an ice towel that they want to put over their head, and they want to cool down, and they feel like that's been something that's going to be helpful to them. So what we want to know is it going to be helpful initially? Is it going to reduce your symptoms a bit? Is it going to reduce how long you end up having symptoms of concussion symptoms, how long they last? And then even the final point would be, do we get people back to play sooner and actually even reduce some of the longer term effects of people that have longer term concussions? So really there's a lot to answer, and we need a lot of people like you that are willing to say, hey, I want to help out medical science a little bit. So we really appreciate your time.
So for the study, you're looking for students who are in sports. Sports-related injury, concussion, ages 12 to 19,
right,
within the first 8 days.
That's right.
Showing symptoms still.
That's right.
Have I forgotten anything?
Nope, we're not going to put somebody on ice treatment if their symptoms have gone away, and there are a lot of kids whose symptoms do clear. But certainly in a clinic like ours here, a sports medicine brain injury clinic, we see a lot of kids whose symptoms have lasted a little bit longer, and they're looking for reasons and ways to get better. And the problem with concussion is there's a whole host of different symptoms that kids can have and different kind of patterns that they fall into. So some kids have dizziness types of concussions, and other kids have what are called cognitive concussions, where they can't be thinking good, and they have trouble with the brain slowing down over. Some people have migrainous, real bad headache type concussions. Other people have a thing called vertigo, where they have eye changes and problems with feeling dizzy and sick to their stomach all the time. And other people have kind of neck muscle type concussions. So there's a whole bunch of different concussions. And another thing that we hope will be a byproduct of us learning about this by getting a lot of concussed patients to study is that we we'll learn like that. There may be certain concussions that it helps greatly and others it doesn't help much, but a couple years from now, you may be doing something that you'll see become a regular standard thing that occurs on the sidelines. So the problem is with a lot of things in research, it doesn't happen right away. And people like me and athletes, we're really anxious to, let's get to the bottom of this in a month or something. It's going to take a while. One of the ways we can speed these up, and I just came from a research conference in Atlanta and spoke with a couple of other children's hospitals, and they may join us in this, and we may look at a multi-center study so we can get to the answers a little bit quicker. We want to help kids like you, and then ultimately maybe your kids someday, to figure out whether this treatment's beneficial.
And we'll share the information about how to inquire about the study.
Mm-hmm.
Not everybody will be enrolled in the study. If you are enrolled in the study, half will get the treatment and half will not.
Got to
right?
have a control group.
And
right?
then there is reimbursement as well.
Yes.
Okay.
Yeah, there is for your time and other things going on, and it's tough. That first day, some people feel pretty crummy and pretty ringed out, and spend the time to allow us to do this treatment again. I can't thank you enough. Thanks a lot for coming down to our center today. Thanks a lot for being a part of this, opportunity that we have to get the word out to more people. I'm really appreciative. Thank you.
And the time commitment is coming in to see a practitioner for about an hour, hour and a half assessment, then doing the 30-minute treatment,
Mm-hmm.
and then day 2 to 4, coming back for another 30-minute treatment, and then a follow-up with the practitioner.
Yeah.
Get well.